G'day folks, Dr. Liam Cartwright here. I've been a urologist for over 30 years now, and I've got to tell you, this question comes up more often than you'd think. Just last week, a 55-year-old bloke came into my Sydney clinic, absolutely worried sick. He'd been dealing with severe lung issues for the past 5 years, couldn't manage any sort of sexual activity during that time, and now his PSA levels were through the roof. Tumor markers looking dodgy too. He asked me straight up, "Doc, could 5 years of abstinence have caused this?" Right, let's talk about what actually happens to your prostate when you're having a daily hand shandy. And more importantly, what happens when you're not. Look, I'm not going to beat around the bush here. Your prostate is a bloody important gland that produces seminal fluid. Every time you ejaculate, whether through intercourse or masturbation, your prostate goes through a complete cycle. It produces fluid, contracts to release it, then recovers. When you're doing this daily, your prostate adapts. It becomes more efficient at fluid production. And here's the kicker, regular drainage actually helps keep the gland healthy. Now, I've reviewed heaps of studies over my career, and the evidence is pretty clear. Regular ejaculation, we're talking around 21 times per month, has been linked to a 33% reduction in prostate cancer risk. Why? Because you're essentially flushing out toxins and potentially harmful compounds that might otherwise accumulate in the gland. Think of it like cleaning out your gutters, mate. You don't want stuff building up in there. But here's where it gets interesting. And this is what that bloke in my clinic needed to understand. While regular activity is beneficial, daily masturbation can sometimes put strain on your prostate if you're not careful. You might notice temporary swelling, a feeling of fullness in the pelvic area, or even some sensitivity. Your prostate needs recovery time between sessions, just like any other muscle or organ. I've seen fellas who've gone overboard and developed what we call prostate fatigue. The symptoms? Less intense orgasms, a dull ache in the pelvic region, maybe some changes to urination. Nothing catastrophic, but your body's way of saying, "Righto, give me a breather, will ya?" On the flip side, complete abstinence isn't the answer either. When you stop ejaculating altogether, fluids can accumulate. This increases your risk of prostatitis, that's inflammation of the prostate, which can cause pain, urinary problems, and yes, potentially contribute to other complications down the track. So what's the sweet spot? From what I've seen in my practice, 2 to 3 times per week seems to be the Goldilocks zone for most blokes. Not too much, not too little, just right. But everyone's different, and if you've got pre-existing conditions, like benign prostatic hyperplasia, you'll want to have a chat with your GP about what's appropriate for you. Now, let me give you some practical advice that actually works. First up, stay hydrated. Drink plenty of water throughout the day. Second, sort out your diet. Zinc is your mate here. Find it in oysters, red meat, and pumpkin seeds. Omega-3 fatty acids from fish, vitamin E, selenium, these all support prostate health. I tell my patients to think of it as maintenance, like servicing your ute. If you're noticing persistent discomfort, changes in your urinary stream, blood in your semen, or if your PSA levels are elevated, don't muck about. Get yourself to a doctor. Early detection is absolutely crucial with prostate issues. Here's the bottom line, guys. Daily masturbation isn't going to kill you, but moderation is key. Your prostate is a remarkable organ that adapts to regular use, but it also needs recovery time. Listen to your body. If something feels off, it probably is. And to answer that question from my patient, his 5 years of complete abstinence didn't directly cause his tumor, but it certainly didn't help his overall prostate health either. We're now working through treatment options, and part of his recovery plan includes gradually resuming appropriate sexual activity. Take care of yourselves, fellas. Your prostate health matters, and it's never too late to make positive changes. If you've got questions or concerns, leave them in the comments below. I read every single one, and I'll be making more videos addressing your specific worries. Cheers.